Welcome back to the Dr. Paul Child Health and Wellness Program. We're taking a look at Dr. Paul's mailbag, and we have a question. Today's question is dealing with asthma. It reads, Dear Dr. Paul, can you please tell me when a child can be tested for asthma? My son is just under 2 and is now on asthma medication, inhaled steroids. I wanted to have him tested just to make sure, but my doctor says that it would be hard because he's too young. What do you think, Dr. Paul?
This is a very common question, as parents want to make sure, and I believe rightfully so, that their child is not on medications unnecessarily. But before discussing the actual asthma test, it is important to know that most children who develop asthma will do so during the first few years of life. The diagnosis is made by the history of symptoms. In other words, it is generally agreed that if a child has either repetitive episodes of shortness of breath, and or wheezing and or cough, and has really no other lung problem, then the diagnosis of asthma can be made. This is what we call a clinical diagnosis. Testing for asthma is really not that simple. The only test that can prove that a child has asthma is what's called the provocation test, where children breathe in a substance known to close down the bronchi or airway tubes. Ordinarily, at a certain dose, everyone will react to this medication or substance called histamine or methacholine, and their bronchi will close down or constrict, which can be measured by the rate at which one breathes out. Children with asthma react to lower doses of the provoking substance. In other words, their airways are more sensitive or hypersensitive. This type of test, though, requires that the child be fully cooperative and be able to breathe out as fast as he or she can, repetitively and on demand. And in general, only children greater than 7 to 8 years of age can undergo this pulmonary challenge test, as younger children really cannot perform this test. So here we have a problem, as most children will develop asthma during the first couple of years of life, and most children can't do this test. The breathing tests that are performed at many clinics and offices, and even with peak flow meters, are not the same. These tests, again, which are only possible in older children, determine how quickly a child can breathe out, and a measure of the airway blockage at that time, and are used to monitor a child's symptoms on a daily basis. Again, these tests are not provocation tests and will not prove whether or not a child has asthma. So a normal test in this instance really confirms nor eliminates the diagnosis of asthma. A chest x-ray is generally used depending on the individual child's situation to make sure that there are no other problems that are causing the respiratory symptoms. Given that asthma testing is really not possible in the majority of young asthmatics, the diagnosis, the follow-up, and the treatment, as well as the decisions to modify the treatment, are based solely on the symptoms and the history that the parents give us. This is why I always recommend keeping an asthma diary daily, which is the best way to document a child's asthmatic symptoms and progress. Parents should record the presence of day or nighttime symptoms, dates of hospitalizations or emergency room visits, peak flow measurements in older children, and very importantly, the need for bronchodilator use. As a matter of fact, asthmatic children requiring less than 4 or 5 bronchodilator doses per week are usually considered to be well controlled, and this is a very good measure to help us see whether or not a child is doing well. Thanks for sending in that question. Asthma is quite common in children, and that's a very, very common concern about parents, making sure the child has asthma so we won't treat them for nothing. Thanks again.
And thank you, Dr. Paul. And thank you for joining us on the Dr. Paul Child Health and Wellness Program. We'll see you next time.
The information presented in this program is designed to be an educational aid only. It is not intended to replace the advice and care of your doctor, nor is it intended to be used for medical diagnosis or treatment.